Good morning, everyone, and thank you for joining us today for our virtual Lunch and Learn series. My name is Sierra Endicott, and I'm the Supportive Care Services Coordinator here at Ironwood. Today, I would like to welcome Dr. Heidi Rula, our Integrative Oncologist and Medical Director of Integrative Oncology. She will be joining us for her presentation of CANT Sleep, Creating Routines to Restore Healthy Sleep. Please help me in welcoming Dr. Heidi Rula.
I'm excited today to talk about sleep. This is a topic that I discuss over and over with patients. So many people tend to be struggling with getting a healthy night's sleep. So I thought I'd put this presentation together so we can go over some ways to improve the way you sleep. Today we're going to cover a number of different topics here. We're going to talk about why sleep is so important to our health. There's this thing called the master clock and circadian rhythm. And so we're going to talk about, how to set that sleep clock and kind of adjust our circadian rhythms. We're going to talk about some things that you can do during the daytime to make you sleep better at night. We'll talk a little bit about what are the stages of sleep, what does that mean, REM, non-REM, and also discuss some supplements that are out there that are commonly being used for sleep. So anyway, we have a lot of things to discuss, and so we'll get started here. But I think I really want to talk about why is it important to sleep, and why do we need to sleep? So sleep is one of these essential things that all living animals are required to have. If we go too long without sleep, we will die. Animals will die without having adequate sleep. So obviously an essential component of life is sleep. It is the time where we restore our bodies and process our memories. So it's one of those days, during the day we go, and at night we need to recover. And so that's part of the reason why it is essential, because we need to have some recovery time. Not only does it impact our physical health, but it impacts our mental health. Sleep impacts not only cognitive function, so the way we are able to perform and concentrate during the day, but it also impacts some other physiologic systems like our blood pressure, right? And our immune function, and it has an impact on our appetite. When they looked at how many hours is best in terms of what we need to get for healthy sleep, it's 7 to 9 hours. There are a few outliers, I think, who have genetically determined that they can get by on 4 or 5 hours a night. But for the majority of us, if we do not get 7 to 9 hours a night, our health will be impacted. We find that, as I said, I see so many patients coming in my office who are not getting good sleep. This is really a national issue. 1 out of 3 Americans are said to have some type of sleep deficit, meaning they're getting less than that 7 hours a night. When it comes to gender, women are the ones who tend to have more sleep issues than men. Certainly I talked to all these moms, who slept well until they had children, and then they kind of kept their brains on a little bit to always be able to hear the cry of their child. And after that was no longer necessary, they still kind of night, which affected their ability to have a good night's rest. Also, I deal with a lot of menopausal women. Menopause is something that seems to disrupt sleep. Men are more likely, however, to have sleep apnea, where we have these episodes where we stop breathing at night, which can have some significant health impacts as well. Sleep, on a chronic, level, if we have chronically sleep deprived, is really associated with a various number of health issues, as well as, productivity and performance. So this is a national issue, but this kind of looks at the map of the country here, and we can see that the states in white are the states that are doing the best in terms of those residents of those states that are getting at least 7 hours of sleep. So in the West, we tend to be getting a little bit more sleep, but even the states that are doing the best, about 30% of those residents are getting less than 7 hours a night. Heading over to the East Coast, to those green states, 38, 44%, of those residents in those states are getting less than 7 hours of sleep. So we're seeing a significant number of people across the nation that aren't getting the recommended 7 to 9 hours a night. Why aren't we sleeping? And certainly, I mean, we're understanding that sleep is so important, but why aren't we getting those hours? Well, some of it is, we're just so busy. I think we have all these things that we need to get done during the day. We have kind of these 24/7 lives where work can kind of really kind of encroach onto our home time. And so we're answering emails and text messages late into the night. We have Netflix binges that we can watch that can go on for hours. And so we get caught up in a show and we don't kind of make it to bed on time. A lot of stress, certainly now in the time of COVID, a lot of people, have seen some increased level of stress. We know stress has an impact on our ability to kind of stay asleep, to fall asleep, and to stay asleep. And then we also, in the modern world, are changing the hours that we sleep. So people who they are shift workers, maybe they have changing shifts and they go from a night shift to day shift. And so, that can really impact your brain's circadian rhythm. We work sometimes indoors all day long. We don't really have much exposure to sunlight, which can really be a marker for our brain as to when it's day and when it's night. A lot of times we, keep nights on, our house is, very lit up as we're getting ready to go to bed. So that light can have an impact, again, on circadian rhythms. Chronic pain is another issue. I mean, certainly chronic pain has been found to be now a national epidemic. And so if you're in pain, it can impact your ability to sleep. So untreated pain can make it hard to kind of fall asleep and stay asleep. And then the other area where we're seeing really a significant increase is sleep apnea. I talked about, sleep apnea is when you have these episodic times where you stop breathing, throughout the night. And sleep apnea has a strong link between obesity. So the more likely that you are obese, the more likely you are to have sleep apnea. So these are, some very common reasons why we're not getting the 7 to 9 hours that is best for our health. So what's going on at night when we sleep that's, really allowing our body to recover, and what's really helping our body restore? We can look throughout kind of our different organ systems, in our heart, our cardiovascular system. We see that our blood pressure is kind of going through different changes. Actually, it's in the early morning hours that we see actually a spike in our blood pressure as part of kind of this natural kind of sleep cycle. And that is really the high risk time for a heart attack. So one of the most common times for somebody to have a heart attack is in those early morning hours. Also, our breathing changes throughout, our sleep. Certain stages of sleep are associated with either kind of slower respirations, and then as we go into REM sleep, much more kind of fast respirations. Our kidney function changes. Our hormones, we have different, so a lot of different surges of hormones are occurring while we sleep. So, if we're not getting good sleep, I certainly can think that we might see some hormone dysregulation. And so these hormone imbalances can be related to the fact that we're not sleeping. Our brain is definitely going through all kinds of processing while we sleep. The metabolism in the brain really changes with the different sleep stages that we go through. And then, as I said, as we go into the REM sleep, which is our active phase, the brain, the metabolism is actually quite high. Actually, we burn a lot of calories with what's going on in the brain metabolism. And so not getting enough sleep has been related to a number of different health conditions. So poor sleep equals higher risk of chronic disease. So you're higher risk of having heart disease, kidney disease, high blood pressure, strokes, and diabetes. We talked about your increased risk, for when we don't sleep, and we can also see how that diabetes might kind of tie into that, and also weight. We're seeing a link between obesity and inadequate sleep. So we'll talk a little bit more about that in these upcoming slides. you can see here, in this chart, going over some of these different chronic conditions, things like heart attacks and coronary artery disease, you have about a 30-40% increased risk of, having one of these chronic conditions if you sleep less than 7 hours. When you're in diabetes, it's about the same in that 30% range. And depression, I thought that one was really, quite concerning. Lots of disorder out there, lots of people on antidepressants, but kind of really going to be back to that link between sleep, may be an important root cause of why some of these things are occurring. Again, talked a little bit about the link between, inadequate sleep deprivation, and obesity. And some of these explanations as to why that might be occurring really kind of revolve around a couple of these issues here. Some of these hormonal issues. There's something called ghrelin and leptin. These are two hormones that are released while you're sleeping. And if you don't get enough sleep, then these hormones will their release will be changed. So ghrelin, which is a hormone that stimulates the appetite, spikes when we don't get enough sleep. And leptin, which is something that decreases our appetite, actually falls with sleep deprivation. So when you combine a spiking ghrelin, which revs up your appetite, and a dropping leptin, which takes away your kind of appetite control, we're really seeing that that can be a big driver in obesity. The other system that's in play here is the endocannabinoid system. And this system is involved in cravings for fatty and sugary foods. So they'd show that people who were sleep deprived eat about twice the amount of fat, over 300 plus calories, compared to those who are getting 8 hours a night. So between kind of leptin and ghrelin and your endocannabinoid system, we can see how people might start putting on weight if they're sleep deprived. When we look over time, what's happening, we talk about, we're going in the middle of this obesity epidemic. On this chart, the solid black line, shows kind of our obesity rates. So in the 1940s, we see the obesity rate is, about 12% or so. When you kind of fast forward to kind of present day, we're now at about a 35% rate of obesity. So about, a third of people in our country are considered to be clinically obese. When we kind of link that to what's going on with the average hours that the average American is sleeping, you can see that little dotted line, shows us that in the 1940s, people were sleeping almost 9 hours a night. And now that the number of hours has kind of dropped dramatically. So kind of to present day, we're seeing that the average American is sleeping just over 6 hours. So as the number of hours declines in terms of the average American's sleep, we're seeing that with that the obesity rates are going up significantly. So it's a strong association, and obviously lots of interest in addressing our obesity epidemic with some of these root causes like sleep deprivation. This is a nurses study here that kind of has shown kind of directly as they followed these nurses and looked at how much they were sleeping during the study period. And they found that, those nurses, during the study who were getting less than 6 hours of sleep, they gained 2.5 pounds during the study, compared to, the baseline of those people who were, getting 7 hours a night. But what is very concerning is that those nurses who slept 5 hours or less a night during that study period had a 32% higher risk of gaining significant weight, and that is defined as 33 pounds or higher. So you had a 32% chance during that study period of gaining 33 pounds or more. So that obviously can have some very significant health implications to put on that amount of weight. Again, and that was really kind of linked to sleep deprivation. So the way our body kind of regulates sleep has to do, and a lot of these other physiological systems in our body has to do with this master clock. So our brain kind of regulates, something called the circadian rhythm, which is our 24-hour cycle. And all living creatures have this circadian rhythm, so that their physiologic functions are impacted by this sleep-wake cycle. And this really is kind of, rooted into the hypothalamus of our brain, which is kind of responsible for this clock. If we're not getting enough sleep, then this clock's going to throw out of rhythm, and it can affect our alertness. It can affect certain physiologic functions like our blood pressure. We talked about all these different hormones that are being altered, right, when we don't get enough sleep. This clock is really influenced by light, right? So light comes in through our eye, hits the retina, and then that gets, messaged back to our brain. And so that really is a big influencer of this circadian rhythm. So this light and dark is a very important piece of helping us maintain normal circadian rhythms. Now, the sleep-wake cycle obviously is impacted by by light, but also genetics. So we talked about how some of these people can seem to get by on 4 to 5 hours and feel very energetic and healthy. Also, certainly how we live our life, these different environmental factors. If we're traveling across time zones, working, different shifts, certainly, changing, from day shift to night shift, or doing all these all-nighters on a regular basis, especially a lot of these college students and things are pulling all-nighters as they study. How we eat and exercise, as well as other substances, can have an influence on our sleep-wake cycle. Our brain is going through different stages, as we sleep, and those stages are going to be divided between REM and non-REM, which I referred to a little bit about. So the non-REM sleep, we have 3 stages of non-REM sleep. Stage 1 is when we just start, falling asleep. It's very light. If somebody kind of talks to us, we're easily, kind of brought out of that sleepy state. And then stage 2, we're still light, but our brain just starts going through some changes. It's slowing down, our body temperature is starting to lower. And it's really stage 3, which is considered to be our restorative sleep. And this is where it's important to spend enough time in restorative sleep so that we can impact, things like our immune function and memory, and, just even things like inflammation in the body can be impacted by whether or not you get, good stage 3 sleep. And then the very active time of our brain is called this REM. So REM, random eye movement, is kind of more, the very active dream state. And this is a time again where we can have all these kind of dreams that we may remember or not remember the next day. But we're going through these different stages of sleep throughout the night. So on average, we cycle about 5 times through each of these different stages, and not necessarily from stage 1 to 3 or into REM. It can kind of vary, but so that really kind of tells us where there's different times throughout the night where we may be more likely to actually awaken out of sleep, because we're going into maybe some of those lighter stages of sleep. It's melatonin, that's that brain hormone, that has a big influence on kind of getting our brain to go to sleep. So melatonin, the sleep hormone, is released from a little gland in our brain called the pineal gland, and usually kind of in the evening we see a spike in the early evening, a spike in our melatonin levels, which is going to start setting the brain up to kind of be able to kind of switch from being in this very active mode into kind of more this kind of ready for sleep mode. Again, usually by 8-9 o'clock we'll see the highest surge of our melatonin. But there's things that we do that may be interrupting that release of melatonin. And one of the big things is going to be, exposure to light during this time, right? So if all of a sudden at 8-9 o'clock, you're watching TV, all the lights are on high in your house, these things, can impact your brain's release of melatonin, and therefore may impact your sleepiness or your ability to fall asleep or stay asleep. Melatonin also plays a role not only on falling asleep, but it plays a role on getting into REM sleep. And that REM, that active dream state, is something that can be impacted by even taking melatonin as a supplement. A lot of times when people take melatonin, they tell me that they have more kind of active, busy, crazy dreams, sometimes nightmares. But melatonin, certainly can have a role in that because it kind of helps us go into more of a REM sleep. Again, REM sleep is a healthy part of sleep, and remembering your dreams is it really can be a sign that you're going through kind of the healthy normal cycling of the stages of sleep. Melatonin also has an impact on other body functions. It has kind of an anti-inflammatory effect on the body, and we found that when people who are night shift workers have lower melatonin levels, and we're also seeing that they may be at higher risk for breast cancer. So a link between low melatonin levels and cancer has been made. It also has an impact on our blood sugar and our GI function. We see that low melatonin levels might increase your risk for reflux, especially those individuals who are having nighttime reflux. Sometimes if we give them a little melatonin, their reflux improves. So anyway, number of different roles that melatonin can play besides just being sleep hormone. The other things that can impact our sleep, or can be things that we're taking, like alcohol. So many people, to wind down at the end of a long day, will have some alcohol, a couple glasses of wine, some hard liquor, or whatever, beer, just to kind of help themselves kind of relax. But that alcohol actually can interfere with REM sleep, and therefore kind of either you have issues with early awakening, or maybe just feeling like you didn't get restorative sleep. There's other drugs that also can have an influence, like nicotine, blood pressure medications, and antidepressants. These also can interrupt our REM sleep and interrupt the quality of sleep that we have. We're using these products that might play a role in your sleep disruption. Some of my patients ask me, I wake up a few times in the night, does that mean, that's a problem? I think it's great, as I said, when you look at the different stages of sleep and that we're cycling through at least, 5 times a night, it's not uncommon for people to kind of either wake up to go to the bathroom, or, they just kind of wake up, for a few minutes and then fall back to sleep, sometimes up to 10, 15 minutes. I think really, as long as you're waking up and you feel, that you have good energy the next day, not having kind of all, your sleep consolidated into one big block is okay. But, if you're having problems falling asleep, then we have to look at what's going on to kind of help you kind of be able to kind of stay asleep, or at least kind of fall back to sleep quicker if you do awaken. We certainly have kind of gone over all the different risks that are out there by having, sleep deprivation. So, what can we do to make sure that we aren't sleep deprived and that we start getting better sleep? And what you're doing during the day can impact what your nighttime sleep is looking like. So one of the things I like to work on is really kind of circadian rhythms. So we talk about light being so important to kind of set, the day, the wake sleep cycle. And so starting your day with some exposure to sunlight, so going outside can be a great way to kind of get things launched for your day, where you kind of look at, maybe the sun rising, or just get a little bit of, light exposure, even sitting outside and drinking your morning coffee, just kind of getting yourself stretched and going can be a great way to kind of get things started for your day. But if you're not able to kind of go outside and see sunlight in the morning, having one of these dawn simulators can be a helpful way to trigger your brain into kind of, setting that wake sleep cycle. And there's a number of different products out there that you can use for these dawn simulators. The one here on the screen is this Philips Wake Up Light, but there's other apps out there that do the same thing. There was a study that it showed that people with a seasonal affective disorder that use these lights, used kind of these light simulators within days, had a significant improvement in their symptoms, just by getting exposed to either a light simulator or this, or sunrise in the morning. So seeing light, so getting your day started with light is an important way to start your day into kind of setting this clock in your brain. Exercise is also important. We found that people who exercise regularly, have better sleep, but you need to make sure that you're not exercising, up until about 3 hours before bed, because if you exercise too close to your bedtime, it can be actually too stimulating to your brain and kind of put your sleep cycle out of sync. There are other things like yoga that can be helpful. Lots of studies on yoga being something that can improve sleep. So having a regular yoga practice, my patients tell me that, once they are doing yoga, their sleep is, just improved dramatically. So again, finding some things during the day that help you create these rhythms can be a way to kind of start returning your sleep to a more normal pattern. Things that you want to avoid during the day that potentially could impact your sleep at night. We talked a little bit about stimulants, so caffeine. Obviously, we're a caffeine addicted society. We all love our coffee, to get our day started without it. But after 2 o'clock, it's best to go decaffeinated, right? To try not to, to consume anything that contains caffeine, because that caffeine can be still impacting our level of alertness at night and make it harder for us to fall asleep and stay asleep. Alcohol, we talked a little bit about, being something that can interrupt that REM sleep. So at least 3 hours before bed, and most of the nights, it's best to really not have that as be a regular part of your wind down routine as something to help you fall asleep. Sometimes if you're napping too late, especially after 3 o'clock in the afternoon, nap can decrease the brain's kind of sleepiness and drive to kind of fall asleep. So it can make it harder at night than to easily fall asleep. There's other meds like decongestants, so pseudoephedrine, phenylephrine. These are all common decongestants that are out there that are stimulants that can impact our brain's ability to kind of go into the sleep stage. I talk about exercise and then actually eating. So not eating, large meals 3 hours before bed. Eating late night meals sometimes can, again, be something that will interfere with the normal signaling to our brain to go into the sleep state. Rituals are another way to kind of start setting the scene for your brain. Actually, our brain, starts to learn if we do things over and over again. It develops, it understands patterns, right? So if we create the same pattern every night that would kind of set us off to go to sleep, our brain starts understanding that it's that you're getting set up to kind of go into the sleep state. Usually I have my patients start about 30 minutes before bedtime, kind of really, kind of winding down so that they can kind of start messaging their brain that it's time to go to sleep. For electronic devices, all these screens that we're looking at, at least an hour or two before bed, ideally. And certainly, avoiding anything that would kind of increase your anxiety. So, not paying your bills or, getting into any kind of, discussions maybe that, would kind of rev up your brain too much right before you go to bed. Can certainly help, your brain be able to switch from that on to, kind of active problem solving brain into, being ready to go to sleep. If you can, doing some other kind of wind down things like taking an Epsom salt bath or, maybe adding a little bit of, lavender to it, can be a nice kind of calming, practice to kind of get your body ready for sleep. Some of the aromatherapy, so some of these essential oils are also, calming. Again, they kind of create a sense of relaxation in your body, which helps from that transition from kind of problem solving active brain to kind of sleep mode. Teas, like chamomile, some of these nighty-night teas, they can be very calming as well and can help assist in that transition. And then a relaxation practice. I think it's so important if you have issues with falling asleep, staying asleep, that you create a nightly relaxation practice. Lots of good data around how relaxation practices can improve insomnia. Journaling is kind of one thing that we, talk to our patients about, as a way to kind of help kind of calm down the mind, kind of get it, kind of cleanse it of anything that it's been working on, just writing it down in a journal next to your bed, just little bullet points of some things that some thoughts, or just kind of clearing your mind of anything to-do list for the following day can be one way. Guided meditations, there's great apps out there like Calm and Headspace that you can download for your phone, and you'll have this voice kind of talking you through meditation, where you have you doing just kind of relaxing kind of all the muscles in your body and just doing some deep breathing that really kind of, again, sets your body into that kind of relaxed place, which makes it so much easier to transition into restful sleep. Some of my patients say, well, I fall asleep, just fine, so I don't need to do a relaxation practice. But it also is beneficial for those people who have early awakening, because if you fall asleep because you're so exhausted, but you still have, a lot of stress and anxiety going on in your brain, you're more likely for the brain to want to come back online too early and kind of have that early awakening. So it can be something that's beneficial for those individuals who have difficulty falling asleep as well as staying asleep. Progressive muscle relaxation is another technique that you can get on, that you can do that on one of these apps. Calm, I believe, has it on their app, or you can go on YouTube and get a guided progressive muscle relaxation. But this is just a practice where you're laying in your bed and you're really going from every single muscle group from kind of head to toe, kind of relaxing, contracting each muscle group, so that by the time you're at the end of the practice, you're completely relaxed. Again, setting your brain up to be able to kind of go into sleep mode much more, quickly than, if you're going to bed with a busy, active mind, laying down and then just trying to fall asleep. So kind of creating some type of relaxation in the body will really help facilitate that transition to sleep mode. Guided imagery, again, this is kind of utilizing your mind, kind of going through kind of different kind of relaxation states. There's lots of, things that you can kind of download, where they kind of talk you through kind of just a way to kind of de-stress and prepare the body for sleep, or even self-hypnosis, kind of working with kind of a hypnotherapist, that sometimes they create a practice for you that can, again, help your brain transition from on to sleep mode. That can be a switch sometimes that we need some ways to help facilitate. And these are some different techniques to help you do that more easily. We know that a dark room, we talk so much about how, dark light is important at night so the brain's not stimulated to stay in the wake mode. So kind of making sure that all sources of light are turned off, night lights, turning off the clocks, covering the clocks on cable boxes and different alarm clocks and other electronics that might be glowing in your room, trying to cover them up so you have complete darkness, making sure you use like dark out shades in your room. A dark room can really help people kind of fall asleep better and maintain sleep. Really kind of making sure that, you're not watching a lot of these screens, TVs, computers before you go to bed. So this blue light that's radiated from these screens, signals kind of more alertness in our brain. So kind of making sure that we're not blue light before we go to bed from these screens. And if that's not a possibility, then getting some of these amber blue light blocking glasses, so that if you have to look at a screen, you can do it through these blue light blocking glasses, so that we don't have that same impact on the retina in terms of stimulating alertness in the brain. And you can make your room cold, that is going to help with sleep as well. 65 to 68 degrees is considered to be an optimal room temperature. Here in the winter, that's not so hard. In Arizona in the summer, might be cost prohibitive for some to make it that cold, but trying to make your room as cold as possible if you're having sleeping issues can help with better quality sleep. Just making sure your bed is comfortable, kind of having it set up so that, you have a good mattress and your pillows are in a way that's supportive, so you're not aching, hurting anywhere. Again, kind of decreasing any pain at night can make sleep quality better. And then pets can be a problem in the room. A lot of people have their dogs or cats in the room. If you're sleeping fine and it's not a problem, great. But if you're having a lot of sleep issues, then trying to see if you can transition the pets out of the room can improve your sleep quality, so they're not interrupting you, waking you up throughout the night, interfering with a good night's rest. So you've done all those things. You've made your room a sleep haven, and been making sure you're doing a relaxation practice and all that, and you're still not falling asleep, what do? Well, first thing is we don't want you to lay in bed for hours on end. That's been shown to actually be counterproductive to getting a good night's rest. So we find that if you can't fall asleep, after 20 or 30 minutes, we want you to get up, get out of bed, go into another room in the house, and do something that's not stimulating. So sometimes I'll have patients listen to like a book on tape, or read a printed book, or read their Kindle with their blue light blocking glasses, until they start feeling sleepy. When you start feeling sleepy, then go back in the bed and try to fall asleep. Again, keeping the lights low and everything as you do this. And if you go back in bed, and you're still not feeling sleepy, then you gotta get up after 20 to 30 minutes and do this all over. And sometimes it can take a number of days or even a couple of weeks really to kind of start setting that. But we really find that for those people who are having disrupted sleep, that really making that connection with your brain, that your bedroom is a place of sleep and not a place where you watch TV and a place of activity. You really want your brain to kind of be signaled that the bedroom is where you're going to sleep. Kind of going through this practice and not laying for hours awake in your bed has been shown to improve people's issues with insomnia. So a lot of different supplements are out there on the market for sleep. I certainly talk about a number of them with my patients. Melatonin is one of the most common ones out there. We talked about it being our sleep hormone. So again, that one generally 1 to 5 milligrams is what we're going to use for falling asleep. If people have issues staying asleep, we might use up to 5 to 20 milligrams of controlled release product. Valerian is another product we use, about 500 milligrams at bedtime. But this one can take up to about 2 weeks to really fully work. It's not one that you're going to just take for the occasional sleepless night. Phosphatidylserine is another one that we use for people who have a lot of stress and are waking up at 3 a.m., taking that one at bedtime. Glycine is an amino acid that has been shown to help with sleep, and CBD oil. So these are all different sleep supplements that are out there that may, be a benefit for some individuals. Again, it's not like one works for everybody, but it may be a benefit to try a number of these to see if they help you with your sleep. If you're still not sleeping, then working with a therapist on cognitive behavioral therapy has been shown to be helpful. Talking to your physician about different sleep medications that are on the market. And if you have chronic pain, really looking at trying to address those chronic pain issues so that they're not interrupting your sleep. Just kind of in summary, sleep is, incredibly important to all aspects of health. That it really is so important to make sleep a priority, and that you really kind of have to kind of set your timer so that you try to get to bed at the same time every night, and you don't let that that Netflix binge or your work kind of keep you up too late on any routine basis, because it can have a significant impact on your overall health. And then creating some of these routines. Anyway, I just challenge you, if you're having a sleep issue, to, for 1 week, try to adopt some of these changes. Try to go to bed and wake up at the same time, for a week. Setting that circadian rhythm, making sure you turn off all your electronics, put in place, pick one of those relaxations and practice that before you go to bed every night for a week, and see whether or not your sleep is better. So anyway, thank you for tuning in. I hope you found our talk helpful. We look forward to putting on more talks.
Our first question here is, are there any side effects for melatonin that we should be aware of?
Yeah, absolutely. I mean, melatonin isn't, a supplement that everybody can take. Some people have issues with, as I talked about, can make you have kind of crazy dreams, nightmares. Some people feel really kind of, groggy the next day, kind of, almost drugged. So, in those situations, you wouldn't want to use melatonin. Actually, sometimes people also feel like it affects their mood. They can feel more depressed if they're taking melatonin on any regular basis. So again, you would only want to use it if you had a positive effect. If it made you feel bad in any way, I wouldn't recommend using melatonin. And in general, melatonin you're going to want to take, at least an hour or two before bedtime.
Great, thank you. Next question. Is it true that going to bed hungry will cause me to wake up in the middle of the night?
I think it depends, on what kind of issues you have with, just your blood sugar regulation, what you've done with your kind of food throughout the day. I think that if you, have blood sugar issues, that certainly that might be the case. Diabetics and, people, who tend to have, a significant fluctuation in their blood sugars might have issues at nighttime. That's why kind of having, if you're going to have anything before we, like a healthy fat, like nuts, nut butters, things like that, avocados before bed, that is a very slowly digested food, doesn't cause, spikes in blood sugar and can kind of stick with you throughout the night.
Great. Thank you so much. And thank you to our viewers for joining us today for our virtual Lunch and Learn, and to Dr. Rula for her very informative presentation on restoring healthy sleep habits. For additional information on virtual Lunch and Learns or on any other supportive care services, please reach out to our supportive care services department at wellness@ironwoodcrc.com or 480-314-6660. Thank you so much and take care.